speaking this afternoon with Riccardo Canavari from Radiopharm Theranostics. Riccardo, good afternoon.
Hello, Andrea. How are you?
Very well, thank you. Look, big news from you this week here, a positive pre-IND meeting with the FDA for Pivalate. Clearly a significant milestone for you. Tell us a bit about the meeting firstly.
Absolutely, my pleasure. So it was Friday last week in the afternoon. We had a video conference with FDA with large attendance, about 15 people from their side, with all the expertise from, of course, preclinical, CMC to clinical. Well, we prepare, I believe, the team prepared very well for the meeting. And the main element of the discussion was about the next phase of clinical development for Pivalate as an imaging agent for patients with brain metastases. So we had the opportunity to discuss different options. I have to say that FDA was very supportive, was also giving us advice that we really, of course, appreciate. And we left the meeting with, their suggestion to go and to submit now the so-called IND in about 60 days from now. And of course, this means a lot of work for the team, but it's great to be busy when you have these situations.
Certainly. Well, as far as the next phase of clinical development, how might that look like? What are your plans?
Based on the FDA recommendation, there is going to be a late-stage development that mainly will assess the patient with brain metastases with two different approaches. So there is going to be the so-called phase 2B part of the trial, where there is one specific protocol, and is about really comparing Pivalate with the results of the biopsy that you can have from the patient. And then there is the so-called second part of the trial, the phase 3, where the protocol is comparing Pivalate with MRI. That is the typical approach for these patients. So it's a sort of adaptive design. You want to find some important element about Pivalate in the phase 2B, and then you continue the development with the phase 3. So I consider this extremely positive, because it will be expedite process. It's difficult to say when it will be concluded, but we will try our best to try to start the trial before the end of 2023. And usually imaging trial go quite fast. So we are excited that we were not too far from a potential approval and then commercialization of Pivalate for patients with brain metastases.
I suppose just for those not familiar, patients with brain metastases, this is a high unmet medical need here.
Absolutely, Andrew. So unfortunately, only in US, there are about 300,000 patients that every year are diagnosed with brain metastases. It is bigger than prostate cancer. It is bigger than lung cancer. And the reason is because brain metastases are happening from different tumor types. So the patient tend to have different, oncological disease like breast cancer or melanoma and lung cancers, called the primary cancer. And unfortunately, what is happening that they generate metastases in their brain. And at that time, is much more difficult to have positive results and outcome. So earlier you can detect and understand how the treatment works, better it is. So FDA really said in their communication that this is clearly an unmet medical need, and that's why they were excited to have the meeting. By the way, they had the meeting on Friday afternoon on the long weekend of the Memorial Day. So I have to say that was a sign that was important for their agenda as well.
Good to speak, Riccardo. Thanks for your time.
Thanks a lot, Andrew. Take care.